at and the problem. So we're going to get started, and I'm going to just try something here for a minute because I'm incredibly honored to be here with the entire panel, but with Congresswoman Donna Shalala. Your career is so inspirational, the longest serving Secretary of Health and Human Services. And so I'm going to just try something. And I've asked Kyle to very quickly unmute everybody, because if we were all in a room today and we were at a conference or a convention and we're in a ballroom of some hotel somewhere, and I'm standing on stage and I'm introducing Congresswoman Donna Shalala, who's one of my personal heroes, we would have a standing ovation. So we're going to unmute the phones real quickly and give Congresswoman Donna Shalala that ovation that you deserve, that we all need to be in a virtual room together. So I, for one, thank you for all your service.
Susan.
Very good. So that was a point of personal privilege, but thank you so much for joining us here today. So we're going to let you kind of kick it off here with just some of your thoughts, and then we're going to have a very kind of quick presentation from Dr. Cheryl Holder at FIU, and then Dr. Rachel Licker from Union Concerned Scientists, and then you're going to come back on and maybe have some response, a little dialogue, and then Mario Ariza, who is with us today, who's the author of the book Disposable City, is going to help with some questions and answers that he's prepared. And so it's going to be exciting, and we will be recording this, so we have it later if people that are on board want to share it with others. So we'll just kick that off. And Congresswoman Shalala, again, thank you so much for your service, and I'll just turn it over to you.
Thank you very much, Susan. Thank you for that nice introduction, for the ovation, actually. And thanks to the Southern Alliance for Clean Energy for organizing this webinar. I should point out that I started my career in government actually at HUD as the Assistant Secretary for Policy Planning and Evaluation, actually. And I was responsible for energy and for clean energy. And I actually put the panels on the White House in the Carter, the solar panels on the White House in the Carter administration. We spent a lot of time not only on solar. Before the Department of Energy was created, we had the big solar program. And so that was the beginning of the government investment in solar. But we did everything from dry basements to permafrost. It was a very exciting time. I had a whole unit, and I was very disappointed when the Department of Energy was created, because they weren't as interested in these kind of innovative ideas, particularly for housing, that we were interested in. And I always thought that we fell behind in solar for housing because we took it out of HUD and sent it over to energy, and they weren't as interested. But it's just a little tidbit about my background and about my early experience on the environmental issues. All of us here in Florida understand climate change as an existential and immediate health threat. We don't have to debate climate change because it's everywhere. It's in extreme heat we feel when we leave our homes, and the violent storms from which we take shelter multiple times a year, most recently in the last couple of days, in the sea level rise and flooding that plague our communities. And just a few months ago, we started to glimpse, we had a startling glimpse of climate change when thousands of dead fish floated to the surface in Biscayne Bay, which I can see from my window in my apartment. This is an unprecedented fish kill and was a direct result of high water temperatures in Biscayne Bay, as well as pollution from stormwater, from fertilizer runoff, and from septic tank and sewage leaks. We still have 100,000 septic tanks in Miami-Dade County. And while we could, if we had the resources, we could link them up, but our infrastructure, our sanitation infrastructure can't absorb some of it. So it's much more complicated than just being able to pay for getting rid of your septic tank. It's whether our sewage system could actually absorb that number in the places that we have to do it. I remember when we built for Philly's farm, we were putting in 30 houses. They all had septic tanks. And I said, we're going to spend the money, which we did, which was very expensive, to link them up with the sewage system in Pinecrest because I was absolutely committed. And those were all LEED certified homes, as was the president's house at that time. The University of Miami has not built a building that's not LEED certified since the beginning of my presidency. I mean, we were literally committed. But 22 of the top cities, the most vulnerable cities to coastal flooding in the United States are located in Florida. And extreme heat and air pollution have already led to increased rates of respiratory diseases such as asthma. Cities in South Florida have some of the worst levels of ground level ozone in the entire country, putting our entire community at risk of serious lung infections. And extreme weather events such as hurricanes pose frequent threats to our safety. And over the past 2 years, in the House of Representatives, we have introduced and passed legislation to rejoin the Paris Climate Agreement, to ban offshore drilling. Where we had bipartisan support, we had the entire Florida delegation except for one person, and to increase funding for green infrastructure and renewable energy. We have demanded that every infrastructure we build that we do be a green bill. We also have set a goal of achieving net zero climate pollution by 2050. I think it ought to be earlier, but that was the deal. Fortunately, because of Joe Biden's election, we can finally make these bills a reality, and we can stop debating whether climate change is real, and start focusing on the solutions, on what we can do to curb this impending disaster and protect the health and welfare of the people here at home and around the world. I keep saying, we don't even debate climate change in South Florida, that we can see it in front of our eyes, and it's not Republicans and Democrats, independents. We have bipartisan groups here. But as our scientists and healthcare workers and public officials work tirelessly to combat COVID-19, we also must begin to prepare for the same scale of national mobilization to tackle climate change. I hope that the COVID-19 pandemic does not take our eye off the ball in terms of climate change. And so January 20th, we will have a new president and a House with a majority and hopefully a Senate that will prioritize this important work of building back better, of transforming our economy, not only to protect and support the middle class, but also to set us on a path for a cleaner, healthier future. And we've got to rebuild the economy green. Joe Biden has promised that, and that will be central to the long-term strategy of this country. So thank you very much, and I look forward to hearing our two experts and perhaps to make some additional commentary. Yeah. Thanks very much, Susan.
Yes, I appreciate so much that you made the link between COVID and climate, because after all, COVID is a respiratory virus. So every time you have solar or you take an internal combustion engine off the road, you're helping to protect people's public health. So now we're going to hear from my good friend, Dr. Cheryl Holder. Cheryl is the co-chair of Florida Clinicians for Climate Action. She is an interim associate dean of diversity, equity, inclusivity, and community initiatives at FIU at the College of Medicine there. And she has really dedicated her career to working with vulnerable communities and underserved communities. And she's also the president of the Florida State Medical Association. So she's got, I know we could go on and on, so I won't, but I'm going to turn it over to you, Dr. Holder. Thank you for being with us.
Good morning, and I'm so happy to be here. And Dr. Shalala, I met you many years when you first came back to Florida when I was at North Dade Health Center. So we've come full circle again, and wonderful having you as an ally in the climate change. I have a few slides. I always want to teach something, and I know you're going to get a lot of the science later. But as Congresswoman Shalala points out, that so much of this we know in South Florida. And what we talk about often isn't so much we hear about the buildings and the sea level rise, and we sometimes forget about the people. And it was a day I'm in clinic again today. I work at Jackson and I'm seeing my patients, and I was seeing a patient, my clinic, and she walked in, Miss Anna Mae, who's always very adherent. So when she walked in wanting refills, I was really surprised. So I'm filling out the refills because my clinic is packed as always, filling her in. And then right when she's leaving, she hands me a form to get her light bill waived from the Florida Power and Light. And I'm like, that's not what's going on. And it was about 2016. And even though we know this climate is and we feel it, until it kind of gets you, you don't realize what's happening. And she was so hot because the nights were hot. She lived in an old house. The housing leaks, the AC escaped, her bill was high, but she needed to breathe. And so much comes around our ability to breathe. I mean, coronavirus has amplified that importance of breathing. And Miss Anna Mae couldn't breathe and she couldn't pay her bills. And she brought me an understanding that I had that aha moment where I had to say something else was happening, that my wonderful Miss Anna Mae can no longer breathe. And we know what it is. We talked about the increase of CO2 and we know where it's coming from. We know it's the transportation, we know it's the electricity, we know it's agriculture, we know it's this, and we know that poor people are exposed to so much. And Congresswoman Shalala talked about the housing policies. We know what the housing policies in Dade County, we know where these highways were deliberately placed, which put poorer people at higher levels of exposure to these insults from the climate at much higher rates. I think of the Latin population that lives in the 3 states, 55% of the Latin population lives in the 3 states that are going to be severely impacted by climate. And so when I see my patients and I think about it and I think of how is climate impacting them? What are the 4 major ways? Pollution, heat, extreme weather. We just had a huge tropical storm that wasn't even that bad in terms of wind, but that water is what we anticipated because it's going to be so high. And we see the flooding. And of course, the poor among us cannot recover as quickly. And I think about what happens when we see the changes in the temperature and the vectors, and we get more West Nile, we had dengue, we have Zika, and then all this disruption of our water and food supply, where I see children outside playing in the flooded water, and I'm like, oh my God, that's contaminated water. Those waters are what we call nutrient rich, and that's what's going to transmit diarrheal illnesses, and our communities aren't aware of this, and we're going to have more of that. We're going to have more hunger, malnutrition. So we're going to see patients that I'm already seeing now at Jackson who are migrating from Guatemala, who are migrating from places because they've already been impacted by climate. And so their food supply has already been disrupted. Disruption of the emotional well-being. Think about what we just went through with this little storm, to think about the water, and every time we prepare, that is trauma. So think about the folks who have lost everything, who have been forced to migrate. I had a patient who I always talk about, who we don't even think about internal migration, but we call them climate gentrification, but this internal migration where they can't afford the high ground anymore. And so they're moving from Little Haiti, from Liberty City, and they're moving into communities that are more vulnerable, like down in Homestead. So we're seeing all of these impacts. And I love this thing. We developed this at the Florida Clinicians, a climate wave. So you won't, Florida Clinicians for Climate Action. So you won't forget exactly what we're talking about. Heat wave, but it is the tip of the iceberg because there are much more illnesses and complications that's impacting the humans that we haven't fully discovered. But when you think of heat wave, think of the heat illnesses, think of the lung disease that's getting worse, think of the asthma, the traumatic injuries. Many people don't realize in Louisiana, the cause of death in New Orleans at that last storm was an electrocution because that person went out after the storm. Traumatic injuries are huge after storms. Water and foodborne illnesses, the allergies. Allergy season is way longer than we've ever anticipated. Think of that child with allergies. No parent wanted their child to be on medication most of their life for allergies. And we know because of the rapid growth in flowers and trees and the more pollen that's there, it's impacting our children, it's impacting their allergies. And of course, the vector-borne diseases, the malaria, the Lyme disease, the tick-borne diseases that's spreading across the United States, and the emotional stress. We are definitely traumatized by this, and it will be impacting us even more. And I bring it back to who's getting it. And this is pictures of showing a child. The children are at lower ground, the ozone level. When we talk about saving our planet, we're saving it right now in my generation. We're saving it for our children and grandchildren, and they are being impacted. African-American women, poor people are being impacted by the climate. We just got some new data on what happens with pregnancies just because of heat and the environmental factors. And again, more pregnancy. And this is my patient who had Zika. And I always bring back to remember what the impact has had on her. And the important thing is that the people who are getting the brunt and feeling the impact right now the worst are those who are not consuming the goods that is driving our pollution, that's driving the transportation sector, that's driving the areas that we see that's causing this disruption. It's really, yet they're paying a bigger price. And then how do they recover? Because when you look at the income distribution and the disparity in care, the poorest among us do not have the resources which to recover. When you're making 59 cents on the dollar like Black and brown people are making, how do they recover? And we know that came from so many policies that Congresswoman Shalala can even tell us even more. And it's time to take action. We got to educate, we got to engage, and we have to advocate. We got to do more of what we're doing. And I close with Jorge. Jorge was my patient. He was an undocumented worker who came out of Central America because of what has happened already there. And the migration out of Central America into Florida. And he was older and sick, and he had very little left because he sold fruits on the side, on the streets of Miami. And he said, rain or shine, cold or heat, I have to work. But as he got sicker and he knew he was passing, he agreed to do this, and he signed because he said, this is my legacy. If I can help somebody else to understand what it's like and what we're going to face, and just for his children and his grandchildren, he has given you his story. Day or night, rain or shine, cold or heat, many of us have to work. And we live in conditions that we will not be able to recover unless we have an equitable response and recognize that it's hurting us now, some people more than ever, and we must act. Thank you.
Thank you. That was incredible. We'll come back to questions and more discussion about that, but we'll hear from Dr. Licker first. And I love working with Rachel Licker and all of her colleagues at the Union of Concerned Scientists, where she's a senior climate scientist with the Climate and Energy Program. Perhaps more important is something that you have in common with Congresswoman Shalala, which is you got both your bachelor's and I think it's your PhD at the University of Wisconsin, of which Congresswoman Shalala was the chancellor. So it's fun that we have all these ties together. So Dr. Licker, I see your slides are up and I'll just pass it over to you. Talk more about heat.
Yes, that's right. Thank you so much. I could not feel more humbled and more honored than to be presenting alongside Congresswoman Shalala and Dr. Holder. I feel I have little to add, but I'll do my best. Yeah, so I wanted to talk about one particular climate impact that has come up a couple of times now that's extremely relevant to Floridians, and that's extreme heat. And we at the Union of Concerned Scientists released a report last year called Killer Heat in the United States. We had a peer review publication in Environmental Research Communications to go along with it. And I wanted to talk about just really broadly kind of some of the things that we found. And for starters, this is, again, something that's come up already, but the point that extreme heat already presents serious dangers to our health and our livelihoods. It's currently the top weather-related cause of death in the United States. Here I'm showing you a graph of the additional deaths associated with the infamous heat wave that hit Chicago in 1995. And I like this particular graph because it can show you what can happen during one isolated event. And so the orange line is showing you the average number of deaths on any given day in the Chicagoland area. And the red line is showing you the number of daily deaths in 1995. So you can see that big spike during the heat wave. That's kind of in that blue period. And the green line is showing you the daily maximum temperature. So you can see that as temperatures climbed above 100 degrees Fahrenheit, the number of deaths were much higher than on average. And still there was a sizable gap between the deaths that were attributed to the heat wave that was on death certificates, that was about 465, and the excess deaths compared with, the average, that was about 700. And the reason for that gap is because in many instances, heat contributes to deaths, but is not noted as the main cause. So heat, exacerbates respiratory and cardiovascular disease, and can compound, a bad situation. And so we actually just don't even, quite frankly, know how many deaths heat contributes to across the United States. We know it is already the number one cause, but we don't even actually have a full sense of how bad the situation is because our data are just not quite there. And so, with respect to climate change, projections of how heat is likely to change because of global warming, they're typically just done with temperature alone. And as you know, in Florida, humidity is a very big part of the story in terms of how we actually experience heat. And so at the Union of Concerned Scientists, we saw there was this gap between information that was available to US residents on how extreme heat is likely to change because of global warming in terms that they are most familiar with. And that is the heat index, which combines temperature and humidity. And that's what the National Weather Service uses to issue heat advisory alerts, the kinds of things that we hear about in our daily weather forecasts. When we hear there's a heat warning, a heat advisory, that's all based off of the heat index, or feels like temperature is another way to refer to it. And so for our killer heat analysis, what we did was we developed projections of how the heat index is likely to change across the United States using really fine resolution temperature and humidity data. We did it for a few different scenarios. We looked at what would happen if we took essentially no action on climate change, what would happen if we took slow action and were able to reduce emissions, but not enough to meet the Paris temperature goals or Paris Climate Agreement temperature goals. And then we also looked at what would happen if we took bold action and we met the kind of, goals that Congresswoman Shalala mentioned, and we're able to meet the Paris Climate Agreement. And so what we found was, before I get to that, what we then did was we looked at the number of days in which the heat index exceeded several different thresholds, 90 degrees Fahrenheit, 100 and 105 degrees Fahrenheit, because those are relevant to different populations. For example, 90 degrees being more relevant to outdoor workers who are continuously exposed, or more sensitive populations up to 105 where everyone's vulnerable. And so we then presented our results at mid and late century at the county level, also congressional district and city. And what I'm showing you here is a map of one of the sets of results. This is at the county level, and this shows what would happen if we took no action on climate change, and how many days per year would exceed the 100 degree Fahrenheit heat index threshold. And what you can see is that the story is really, really dramatic for Florida and much of the southern United States. And it's pretty dramatic for the entire country, but Florida is really pretty much the most affected. So I have a bit of a zoom in for Miami-Dade County, for example. And so if we took no action on climate change at late century, we project that Miami-Dade County would have 166 days in an average year above 100 degrees Fahrenheit. And that's in contrast with historically where that number has been 41 in an average year. So that's incredible. That's about half of a year spent with temperatures above 100 degrees Fahrenheit. However, by meeting the Paris Climate Agreement temperature goals, we could keep that number. It still increases, but we could keep it to 115 days per year, which spares Floridians almost 2 months of temperatures above 100 degrees Fahrenheit. And the reason that that number does increase over the historical is because of the decisions that we've already made. We've already committed the world to a certain level of climate change that we're already experiencing because we didn't take action early enough. But that doesn't mean that there isn't a reason to take action now. There's actually a huge reason because there's so much that we can do to keep the world safer, to create a better future for our children and our grandchildren. And so I do want to emphasize that this is not meant to sort of say that the buck stops here. And, what would this really mean for Floridians, having a world in which half of the year is above 100 degrees Fahrenheit? It would mean significant changes to the way of life across the state. It would mean, it's too dangerous many parts of the year for kids to play outside. I think about my nephew who came to visit me once during a really significant heat wave in Washington, D.C. And he said, it's weird. This is kind of like a snow day for us in New York because we just can't go outside. It's just too hot. And that was not a concept that he was familiar with. When it's that hot, it's dangerous for workers to plant and harvest our fields. These kinds of extended conditions make it dangerous for postal workers. It presents huge constraints and barriers for those who build and construct our businesses and our residences. And obviously, those impacts are not evenly distributed. As we know, the people who plant and harvest our fields, who build our homes and our residences, are disproportionately not white and don't have equitable access to quality healthcare and productive services. It also means significant constraints for tourism across the state of Florida. Who is going to want to visit Disney World if it's extremely, extremely hot? It's going to start to drive down, interest in spending time outdoors at those kinds of facilities. So again, my main point really that I want to leave you all with is, yes, we have committed ourselves to some level of climate change, but there's so much that we can do to chart a safer path forward. And we have numbers that we can look at and say, my gosh, we could spare 2 months of these kinds of extreme temperatures if we take action that we know we have access to. We know the technologies, the renewable energy, infrastructure we can be investing in, the kind of lifestyle changes that we need our leaders to make available and easier for all of us to implement. So with that, I just would like to thank you. I'll leave you with my contact information, and I look forward to engaging in the discussion. So thank you so much.
Great. All that talk of heat, it's like you just want to go. And, there's that old adage that when you find yourself in a hole, what do? You stop digging. So clearly we're in for some climate impacts for sea level rise and heat and lots of other impacts. However, let's not make it worse, right? Let's adapt to the climate impacts in the pipeline and let's turn that CO2 spigot off tomorrow. So I wanted to see, Congresswoman Shalala, if there's sort of anything that was said by Drs. Holder and Licker that you'd like to comment on before I sort of turn the gavel over to Mario, who's going to lead through some questions and answers.
Yeah, I think that was what was scary about Dr. Holder's presentation is that at least in South Florida, we're beginning to look like a developing country because of the impact of climate change on the spread of disease. And while we've talked about heat and about other things, the fact is that the spread of disease and not only diseases that are coming in maybe from Latin America or other places, but the nature of our climate, we really did control Zika. I mean, our mayor and our health people really got in there. and did everything they needed to do. But the second thing that you said was a reminder that public health includes mental health and the mental health impact of all of these things. And third, I want to point out that if you look at the census tracts in my district, the people that get COVID live in low-income districts where they're multi-generational families living in small quarters in which someone has to go to work. And those homes, remembering that we made big strides in public health in terms of building codes, we still have large families living in small quarters in low-income neighborhoods. And while we did some things in terms of building codes at the turn of the century and later on, and even in Miami-Dade, we have less buildings, big buildings falling down because of building code changes after Hurricane Andrew. But we still have a lot of houses that are damaged as well. And finally, let me make a couple of comments about Dr. Licker's presentation, because we got to keep remembering heat. We had a lot of people in a nursing home die because they didn't have a backup generator. Florida had to require backup generators in nursing homes. The idea that we had to do that in this century is scary. But we still have nursing homes that aren't quite up to code in terms of backup generators. And we still have a lot of situations in which housing doesn't have backup generators. And that's a real problem, because the elderly aren't just in nursing homes. They're in other settings, and we should remember that. And Dr. Licker's presentation he reminded me that we've made big strides in public health with sanitation, with building codes, but we have to keep going back and looking at those. We can't depend on vaccines. I worry that people think vaccines are going to save us when it's lots of other things that we need to do. And the disparities in our community, in my district, the disparities are huge. I have some of the richest people in the world and some of the poorest. And some of the poorest that don't have access because their legal status is questionable. So I just thought these two presentations were excellent, and I didn't want to take more time than that. Thank you.
That's great. I couldn't agree more. It's such a wonderful presentations, but sort of scary at the same time. So let's bring in Mario here. Mario Alejandro Ariza. You have one of the most beautiful names. I love it. Mario covers the federal courts for the South Florida Sun Sentinel, and he's an author of a very recent book called Disposable City, Miami's Future on the Shores of Catastrophe. So I wanted to, there you go. Oops, you got to turn it upside down.
It's always backwards when I show it.
Yeah, there you go. Save our ship. So anyway, Mario, I invited Mario to join today because, when you write a book, you just dig into all of these issues. And so he's been writing about this set of issues. And I just thought he would bring a certain perspective. So to sort of pose some questions really to the three panelists. And then we also have questions coming up in the chat room, and I'll sort of help you with that a little bit, Mario, but I want to send it over to you first.
Sure. Thank you so much for the opportunity to have this conversation with you folks. These were some fascinating interventions. I wanted to start off by asking a positive question, right? Because a lot of the times when we talk about climate change, we get to thinking about how bad things can get. But I wanted to ask all three of you what a good public health system, or a functional public health system, an equitable public health system could do. What would it look like? And what it could do to help fight the negative effects of climate change?
Well, I'll start as a doctor. The foundation of everything is education. So a good public health system would take the lead in educating all of us and helping us connect the dots a lot faster. And then from there, building in the policies that's going to drive this. and bringing the collaboration between the health sector, the building sector, pretty much every sector has to come together now to impact this change. I talk about an examples that has happened before, and I often use HIV. It's not ideal, it's not perfect, but if you think back on the beginning of HIV, the activism that was there, the NGOs, the governments, the policies, the driving, and also for the individual patient was an equitable response, because the HIV positive patients received housing assistance, they received job assistance, got peer counseling, they got the medication, they got healthcare. All their social determinants were addressed. So it used the public health system where we alerted the community, we put in the preventive measures, but we also responded equitable to the population that were at risk. And then we fought stigma, but it wasn't just one sector here. It was where we collaborated with the scientists, the public health, the politicians, the church, everyone came together. And I think it's going to be that type of collaboration that's going to be required worldwide to impact this thing quickly. Coronavirus again showed us when you come off message, you don't have trusted messengers, when you do mixed messages, you don't respect the science, and you don't address the social determinants, you end up with what we're having now. So I think HIV brought it under control. We'll probably have a cure in 10 years, and this is in less than 50 years that we have been able to take a disease that was millions of folks, and we're bringing it to cure probably in under 50 years. So that's, for me, the hopeful message is that we can do this with climate, but it will require a collaborative, intentional approach and also an equitable approach. You wouldn't have done it. HIV has some of the best statistics in terms of Black, brown people in how long they live and how well they do and what their viral loads are controlled. And that's because we responded in an equitable manner to the population. So that's where I see public health coming. And we have models that have done this before.
Yeah, let me add to that, because we also have a big problem with HIV in Miami because of the Hispanic population. But I was pleased to see on Biden's task force that that Goosby was there, because Dr. Goosby out of UCSF has spent his career dealing with HIV. And I think the important thing on HIV is that we never did find a vaccine. We found a treatment and we changed behavior. And we built comprehensive support systems around it with different, once it spread across the country, when it was on the two coasts, the politics were horrendous. But once it spread across the country, then we were all in it together. And there are some lessons to learn there. But in terms of direct public health, we have a very weak public health system, even under the great Lillian Rivera, who really brought things together here. But she has since retired. The problem is it's a state agency located in a community that needs resources and nimbleness by the public health leaders. And I wish that it was a county agency with state resources, with some state guidance and national guidance, because then we'd be able to pull the pieces together. It is totally underfunded.
Totally.
Yeah.
In fact, Jackson, the University of Miami, Florida International play a bigger role in public health in our community than our public health agency. And when you get someone as gifted as Lillian Rivera, the previous person, you know, you can pull some things together. And I work with her on HIV testing, for example. It helps, but it's totally, completely underfunded. And without direction from the state, or really a deep involvement by the state. And we have to figure out how to overcome some of these things with some direct funding from the CDC, and raising the status of public health and increasing the number of public health workers in our community. So there are a lot of things we can do here that will help us on climate change and its integration into public health.
And I think some of the additional thoughts that I would add are kind of specific. I think that, as I mentioned before, we don't have for extreme heat, and this is true for so many different issues across our country, we don't have a full sense of how many people are actually at risk. So, this is basically, from my perspective as a scientist, a lot of people are hidden in our country. And that is a reflection of who we value, and there are a lot of lives that we're not taking the time, we're not investing the resources to tracking how climate change is likely to affect them. And so we need to be investing, into our ability to actually just see and quantify and know who's actually at risk so we know how to better distribute resources. So I think, that is sort of maybe a very specific thing, but I think it could be a really powerful thing to be investing better into. And I also think on the risk communication side, there's so much that we could do to, to serve people better. We think about how, if someone's missing or if there's a tornado, we just have an alert, whether we like it or not, that pops up onto our phone. Well, what about other climate, risks that people might be facing? I think that's an interesting value question as well, what we are and aren't choosing to communicate to people. And, also the things that people can do to stay safe. So I think if we can, expand our thinking about that, and I mean, why not? That just seems like we have the technology. That's just, again, a values question, and we could actually better communicate information in a more targeted way so people know it's dangerous to go outside if you have a respiratory illness. Here's what you need to do to stay safe. There is a hurricane coming. Here's your nearest shelter. Here's how you get there safely. And if you don't have a ride, here's how you get a way to get there. So there's just so much we could do. And I see them as relatively low hanging fruits that we just need better investments into. So those are somewhat specific, but
no, those are great. You actually preempted my my next question. I was going to ask what we're not measuring and what we'd like to measure. See, I think I've spoken with Dr. Holder about this before.
Yeah.
We don't have a sense of how many heat vulnerable seniors or individuals exist in Miami-Dade or Broward County. We don't even have a sense of how many low-income people regularly get flooded, which is something that I'm trying to figure out on deadline today. Good luck to me. But I wanted to ask,
the health related things, we don't have a good data, because there's really, if you look what physicians use, the ICD-10 codes, the coding does not capture heat properly or exposure to pollution. Or when you get a traumatic injury during a storm, you might just see fracture coded, but then the context wasn't there. So you're not capturing how it's related to what's happening. And they do have some big Z codes, but then there's no reimbursement that's attached to it. So our structure really doesn't support what's happening in the 21st century with climate, our billing structure, our health systems. And that really has to change. So there's a lot of data that's missing, and a lot of clinicians are not even aware that they should be collecting this. And the patients aren't aware that some of these things that are happening to them really didn't have to be this way. And then what can we do? So definitely data is missing.
Well, and the census, the new census is not going to help us because we didn't get the level of participation that we needed to be able to target areas. And you almost have to go community by community. If you want to know about flooding, I could match census tracts to the flooding areas. We certainly have flooding data.
Literally trying to match the social vulnerability index to the flooding data later this afternoon. But I wanted to ask you each if there was...
That may not be, remember, you're looking at policy, because you remember how Miami was developed and Jim Crow.
Right. So
when you put housing by railroad tracks, which was the undesirable property, poor people live by railroad tracks, which are now high ground. So your flooding may not be tracked to the poorest communities unless maybe in 10 years it will, but the total climate gentrification hasn't completely obliterated Liberty City. It's impacting Little Haiti and other areas, but you're going to see a little differences there because of where Black people were forced to live.
That's right. Yeah. No, and that's the historical weight of the development. And I have to figure out whether or not that applies to Broward as well. But I wanted to ask if there was one.
It did for a while. The Sistrunk corridor, but that's also being gentrified. But newer neighborhoods in Broward are definitely underwater.
I wanted to ask you folks if there was one thing that you could change in terms of policy, if there was one policy lever you could pull, and this is how I sometimes end interviews, what would it be and how would you pull it?
Oh gosh, there's so many. I mean, if you're going to get to the root cause, it will be on fossil fuel. So, but for looking at what the population I work with needs, it's how to bring in the green infrastructure and create jobs and improve their overall well-being. People, if they have the dollars and they have the knowledge, they will be empowered to make better decisions. But so I think I would go around using more green infrastructure, solar, wind, and improving the population so they can respond. Because just cutting out fossil fuel is not going to change what's already in effect.
Mm-hmm. Mm-hmm. Yeah, that's a really interesting question. I am sort of, I'm struggling in my mind between, as Dr. Holder, said the root cause and how do we get at that? And I think one thing that I just, how can we finally put away and put aside? I guess it just, for me, it comes back to like getting money out of politics. If we can get, the fossil fuel industry to stop, being able to buy their own politicians and, influence the policies so much, I think that we could maybe finally, the American public could finally get to see science and what it's actually saying and not have to be subject to these disinformation campaigns that we have so many leaders subscribing to. We see even right now in the news, this talk of the National Climate Assessment and the U.S., the agencies that are leading this and that, we have all these sort of different characters now getting involved. It's like the Trump administration's last attempt to derail climate science on its way out. So I just think, if there is a way to get money out of politics, that to me is a huge root cause of where this all came from.
On a final exam that I always gave in my health policy class, I always asked the students, what is the one thing they would tell the new president, or one thing they would do to get healthcare reform, to make sure that we got universal healthcare? And the kid that got the only A+ in the class said campaign finance reform. Right. He had one sentence. He was scared to death that I was going to flunk him. But I thought that was the best answer to
Mario,
what I expected a complex answer to.
I couldn't agree more on the money, but Dr. Lynn Bringenberg has a question in the chat that relates to this, and she's wondering how quickly could we achieve the blueprint that Congresswoman Kathy Castor's the Climate Select Committee in the House has laid out. So Congresswoman Shalala, that's probably for you, but it seemed on point with your question, Mario.
Yeah, they're drafting legislation now. They're working on, it takes a while to draft the actual legislation. They've laid out the outlines. And they have to draft the legislation. It's not going to be one bill because it's got to be put in a number of different places. So they're drafting the legislation now. The question is, with the margins that we have, can we pass that? And I don't know the answer to that question. We certainly would be stopped in the Senate on all of it. And but my question is, when I looked at it, how much could we do by executive order?
Yeah.
How much could Joe Biden actually do? I know he's going to reverse a bunch of things, but how much can he do in a positive way? And I don't know the answer to that question, but what we expect is for both the administration and the House staff to go through it with a fine-tooth comb and figure out who's going to do what. But by the way, you always do stuff. If you're going to do anything, you got to do it your first year.
Yep.
That's accurate. So
And I've always worried that we were going to just focus on COVID our first year, as opposed to making sure we get on top of climate change at the same time. We will get on top of climate change in the executive, but the question is how much can we pass the legislation we've already passed, what the Senate is going to look like, and whether they're willing to negotiate. And the problem with negotiations is the fossil fuel people will win their piece. But I don't know how far we can get. Sorry, too long of an answer.
no, that was incredibly insightful. And that actually sort of brings us to the subject of COVID-19 and climate change, right? There are a lot of parallels between the effects of both on health, specifically in regards to the social determinants thereof. But I wanted to ask you folks if you had any suggestions for ways to both fight the virus and address climate change and its health impacts, right? Ways that we might both sort of hit two birds with one stone here, because we are going to be fighting the virus for the next year and change, and we don't have a lot of time to address the climate crisis. So are there ways we can, row the
Pollution. If you look at the data on pollution, how it increases mortality with coronavirus. Look at the people who are susceptible, who are living in the more polluted areas. If you look at what happens, pollution and maternal mortality, maternal issues. And if you look that when we improved the environment, we had decrease in preterm births. We had less premature babies worldwide when we saw the total shutdown. So I think if we can address pollution, and that takes you to fossil fuel, that takes you to a lot of policies, that takes you to energy efficiency, just trying to get our energy use down and improving our pollution. I mean, it comes down to sugar burning, stop the sugar burning. There are certain things that we in Florida should do immediately to address pollution, because then that will save lives with coronavirus. Because the population that's getting it are weathered already. They're sicker, they have lung disease, they're in the vulnerable areas. Address pollution.
And I agree with that. I would also plant a lot more trees.
Yeah.
And put the money to maintain the trees. My poor communities
Yeah.
can't afford to maintain their trees, so they're
Exactly.
them now.
I would do both.
Yeah.
No question about it. I mean, I would do some green things too, like planting more trees in low-income communities.
Yeah.
And I clean out lots, and we're focused on building affordable housing in lots. I'd rather have parks. I'd rather go up higher with affordable housing, which would make it cheaper, and put in some parks with trees. So I would do the affordable housing, but I do it with building code changes.
Yeah. So there's a lot of empty lots we can turn, and gardens.
And gardens. But the other thing is we need to zone for granny homes, for apartments. I had a terrible time in Pinecrest when I built the president's house, because I wanted to put an apartment on top of the garage for the security guard driver. He was a single male, and I wanted him to live on site. And I thought having a garage apartment was kind of a cool idea. And boy, I got it through, but they didn't want me to put a kitchen in or something. I mean, we finally did it in the middle of the night, I think. But when we build the houses, building garage apartments, I mean, there are a lot of things that we can do so that we can do these vest pocket parts. I have to leave at noon, I'm afraid. I've really enjoyed this. I'd like to stay on for another hour.
No, this has really been a great discussion. And we always do try to keep on time. So we could go for another hour. This is such an important issue. And I feel like health is an issue people understand. They can connect to. As someone who's worked on climate and energy issues for 2 decades, for some people, it does seem longer term, and it's harder for people to kind of have it in a context of their own life. The conversation today, and Cheryl, I just love the slide with heat wave because it just sort of,
Very
lays
cool.
it all out, and how complex this issue is. So let's just go around the room. We'll end with Congresswoman Shalala, but very quickly, Mario, Rachel, and Cheryl, and then to you, Congresswoman, just your last final 5 words.
Well, thank you folks for an incredibly enlightening discussion. So I just want to thank you for participating, because these are the kinds of chats that we need to have more often.
I'll just say
Rachel?
thank you so much for the opportunity, and there's so much we can do. We need all hands on deck.
It's impacting all of us. We gotta go out there, connect the dots in your life and your family's lives. And yes, there's some of us who are gonna feel it more than others. And for those, we have to find the solutions that work well, that's equitable, that helps the lesser and also help you. Because any climate solution is a health solution.
Sarah.
Yeah, thank you so much. I just learned a lot. I love these panels because I learned so much. I should have listened even more, but I really appreciate the opportunity, and invite me again.
Yeah, no, we will. The threat is real, and that's where we spent a lot of time focusing. There's been a number of folks in the chat room. We do have solutions. It's cheaper. Solar energy efficiency, battery storage is coming down. It's cheaper than building a fossil fuel plant. We do have an energy system that is devoted to fossil fuel because of what you talked about earlier, the influence of the money. And we're going to have to break that down. But there is hope. But we have this very short window, and the window is now. And so we've got to do everything we can. But really, it's cheaper to drive an electric car, and it's cheaper to do energy efficiency than it is to build a gas plant. So we need to keep our eye on that, and we have to stop subsidizing polluters to pollute for free. So
You bet.
with that, we have this recorded, so we'll send it out to everybody. So if you want to listen again and capture some of those slides, and I know that both Cheryl and Rachel would be interested in sharing that with anyone. So with that, we will bid adieu. Thanks, everybody.
Thank you. Stay safe. Mask on.
Yes.
Put your mask on.